Well, hello, hello, hello. I am Pastor Rhonda, founder of Celebrate Life Cancer Ministry, and your host for Celebrate Life Today. I thank you all for joining us, and we have an exciting time available for you today. So, hopefully, on this holiday, July 5th, you'll be able to sit back, relax, and watch. But if you have questions, feel free to ask them, type them in the chat box on social media, and we'll put them up on the screen and we'll answer them for you. But if you're on YouTube, please go ahead and subscribe today so that you will not miss any of the conversations that we have with Celebrate Life today. So today, good morning, good morning, good morning. I want to welcome Dr. Maggie Smith with us today. Hello, Dr. Maggie.
Good morning.
How are you?
I'm good. How about yourself?
I'm good. Now you said good morning because I said good morning. Where are you? Aren't you on the East Coast?
I'm in Chicago, so the Midwest. So
Okay.
yes. Good
Okay. Awesome.
afternoon.
Afternoon. And by the time people get a chance to see this, no telling where they'll be and what time it will be. So I like to say good morning, good afternoon, and in case I don't see you, good night. So let's go ahead and get started. Let's talk. We're gonna have a little conversation about cancer prevention. So why don't you tell us a little bit about who you are and let's get the conversation rolling.
Sure, not a problem. Thanks for the intro and thanks for allowing me to be here on this platform to help raise awareness about cancer prevention. But I am an oncology certified nurse and I have been for the past 20 years now, 20 or 21 years now. I've actually had experience primarily in oncology in bone marrow transplant, which is hematologic
Mm,
malignancies, as well as solid tumors. So when I say solid tumors, it's like breast cancer, prostate cancer, those of the primary organs, et cetera, and body parts. I currently work in the pharmaceutical industry as a director for their medical affairs division in oncology, and I'm also a professor. So I teach as an adjunct faculty at a local university. I am a strong advocate for underserved and underrepresented populations. And as a matter of fact, that's what I did my doctoral studies in terms of how to address that to ensure that underrepresented and underserved populations are actually represented at the table and that we have the adequate knowledge and education to make informed decisions. So that's just a little bit about me in regards to what I do. But what has really brought me here is my professional organization, the Oncology Nursing Society, where I served as the former board of directors, still governing over all members, which encompasses about 39,000 nurses. And we are very strong in terms of our mission, which is to advance cancer care and ensure that there's quality care and innovation to advance our profession.
well, my goodness, you were just absolutely loaded. But it's so encouraging to know that the professionals who are assisting us are continuously learning, to continuously developing their skill, and so therefore they are in the forefront of bringing us the best and the newest information, research, support, knowledge, tools, processes as we go along this cancer journey. Because I am a 20-year inflammatory breast cancer survivor.
Congratulations.
So I was like, wow, you could have been my nurse. And to see the progress that cancer has gone through from the time I was being treated to now is just amazing.
Yeah.
So I often have to talk to other people to find out how are things now. Are these things normal? Are these things because it sounds a little new to me sometimes, and that's good. That's good. But we're here today to actually talk about prevention because we're going to have a number of conversations going forward about various types of cancers, various stages of cancers, various treatments, various things to be aware of. So we really wanted to start this conversation at the beginning.
Yeah.
So we can talk about prevention. So how about it, Dr. Maggie?
So, prevention is so important in terms of just making sure that you take care of your body and that you are in tune with your body. And when I say being in tune with your body, is just knowing your body so that you can be able to recognize when some changes are starting to occur. So, knowing how to recognize your normal from the abnormal so that you can be proactive and seek the necessary medical attention that you should be. I usually always inform everyone if you notice some persistent new changes or symptoms and they stick around for 2 weeks and greater, then something's wrong. So don't take a back seat to your health. Be proactive and seek the attention of medical professionals to be able to help you to get to the bottom of it so that things are not diagnosed at such a later stage or they're more aggressive, where aggressive modalities have to be implemented in order to get the disease
Mm.
under control. I think for minority women, Black women, we are so used to being the nurturers and taking care of everyone else. We always seem to take a back seat when it comes to us. So one of the things that I do when I'm out, encouraging women in the community is try to empower them to be more self-aware and to practice that self-care and be a little bit selfish. Self-care is not selfish, it's just putting yourself first.
And that's two different things, isn't it?
Yeah, it is. It is. It certainly is. And some people get that, a little bit confused in terms of, well, I have to do X, Y, and Z. Well, if you don't take care of yourself first, you won't be here to do X, Y, and Z. So,
And
yeah.
we don't think about that long-term process. We're
Mhm.
always in the right now, what I
Yeah.
have to do right now. Well, what you need to do right now is take care of you.
Yeah.
So you have the strength to take care of somebody else.
Absolutely. I have to tell you, it's like I lost, close family members due to, unfortunately, a lack of knowledge. And where some of the diseases could have been controlled had they trusted and sought after the attention earlier and followed the recommendations of the healthcare provider, that things would not have made a change for the worse. I think one of the downfalls for people in general is because they feel fine. They feel fine now. But as you just alluded to, it's the big picture. It's like you may feel fine now because the cancer or whatever it is in very early stages. So the symptoms that you are experiencing, you just equate that to something else and you blow it off. But months or years down the line, when the cancer has gotten like completely out of control and it's at an advanced stage, it's now I want to take the action to do what I have to do because I want to live. But if you just could have turned back the hands of time and followed the advice of the medical professionals who were advising you and giving you care at that time, we probably would be at this stage that we are at now, trying to scramble and see what types of resources we can pull together to support you and get the cancer under control. I share that story because this is something that just happened a couple months ago with
Wow.
with a family member, and it's tough, and unfortunately, we tend to fall down due to a lack of knowledge.
And it's amazing. People don't realize that if you go and you do it while it's new, um, one, the biggest thing is when you don't address it when it's new, it then becomes part of your mental normal.
Yeah,
And that's what causes us, I think, which causes us to keep moving without what was like not moving, not going forward with doing the right thing.
yeah,
And we usually are afraid of what they're going to say. But if you get it, how afraid are we? Are we afraid enough to handle it now? Are we afraid enough to get rid of it now? I often give this illustration from a layman's perspective, doctor,
Mhm.
that says that if I were a a abnormal cell and I stand by myself, it's easy to handle me.
Yeah.
But if I have someone else come and stand close to me and they're rubbing up against my shoulder and now they become an abnormal cell, then I have another person that comes and stands next to me. Now we have this little group of abnormal cells that had I handled it when it was just me. It could have been a done deal of
Yeah.
just a simple surgery, a simple process, at least much simpler than it would have been by the time everybody is standing all nice and close and or even spread out.
Yeah.
Start to begin to break off and go start another cluster.
I agree.
So we don't think about that. We just get so nervous about what's the doctor going to say.
Yeah. I agree. I completely agree. And that, I don't want to keep using this family member as an example, but it kind of just, it disturbs me. It disturbs my spirit, because going to, sticking to our topic in regards to preventive health, she had a gynecologic cancer, which could have been treated and under control. She could have been in remission. The one thing that she neglected to do was to follow up and get her annual preventive examinations.
Wow. Wow.
So that's so important for us as women. So those preventive examinations, just to pick up on the abnormal cells and then know what the next steps are to see, does this require further diagnostic? Does this require a scan? Does this require some intravenous treatment or some oral therapies to get it under control? And then we can discuss the next steps. So her cancer was actually a cancer that was diagnosed at a very, very early stage. And as I stated, she could have certainly, still been here to share her testimony. And it, followed the necessary medical treatment modalities. And she, things would have probably turned around to be different. She was also a smoker. So as we know, smoking causes, a variety of things, not just cancer. It increases your risk of lung diseases, can causes increase in blood pressure, etc. And the other thing, unfortunately, she lived a very sedentary lifestyle, which does not help in terms of making sure that you decrease your risk for the development of other chronic diseases. But it was a combination of things that she took on, not to mention she was like the everything to everybody in the
Okay.
family. So it was, even in her, her days when she underwent chemotherapy, she was still running around to make sure that she did what she needed to do for her mom and her aunt, and so it's like you just that goes back to just slowing down, taking care of yourself. But it's unfortunate that we don't trust sometimes. And I think that is due to a great reason of the experience and the history that we've experienced over the years. And I think at this point in time, we have more rules, guidelines, and regulations in place to ensure that does not happen again. And if we just take our own time to research and read some of the resources that are out there and available to us, that will certainly help us to make better decisions in regards to our health and our family members' health as well.
So do you think that okay, so if I'm understanding in this scenario, um she was already diagnosed with cancer.
Yes.
Okay, so did you get a chance to talk to her to find out if it was fear or what her challenge, or did she have, we often face disparity issues.
Hmm.
It could be insurance issues, it could be can't get an appointment, it could, especially in this COVID season, it could be a lot of things. Did you get a chance to ask her about that?
I did. In my family, and I'm quite sure in a lot of other families, when you are diagnosed with cancer or other diseases, some people feel as though they want to go into just like private mode.
Okay.
So initially, she kept everything a secret from everyone,
Mm.
but you can tell like that something wasn't right. Now, this isn't a family member that I'm around all the time, but
Got
I'm
it.
around enough to know that I notice a difference in how she's behaving and interacting and things of that nature. So it was just her lack of trust, her fear, her wanting to try other treatment modalities that did not work for her, that unfortunately required her to spend a great deal of money and time away from her family and those who loved her, just to try some other modality that didn't work.
Mm. Wow. Yeah, well, we all have different reasons and concepts as to why we do what we do.
Yeah.
So, but that's why we're here today to talk about prevention.
Yep.
Catching this early,
Hmm.
knowing our bodies, knowing ourselves.
Yep.
But you know what? Sometimes, okay, so I know more about breast cancer, but there are other cancers out there like Hodgkin's lymphoma, like bone cancer, bladder cancer. There's so many different things. Some have early screenings, some don't.
True.
Some we have to know our body and know what's different, and some we can just schedule. So, what can we do to in the prevention stage of the cancer?
So maintaining a healthy lifestyle. So you have modifiable and non-modifiable risk factors that put you at risk for the development of cancer or any disease. So the modifiable are the ones that you can take control of and change. And the first one I mentioned is the sedentary lifestyle. So being active. The American Heart Association recommends that you do at least 30 minutes of moderately to vigorous exercise at least 3 to 5 times out of the week. For women, I'm always encouraging that it includes some strength training because
Oh,
we have issues with osteoporosis, weak bones, etc. So strength training also helps to strengthen those bones and to make sure that we at least can reduce our risk of some of those diseases that come along with having weak bones, osteoporosis being one.
so is that like bench pressing 150 pounds?
No, you don't have to do 150 pounds, but at least some type of strength training that's a little bit challenging to you. If the rule of thumb is if you go low on the weights, that you do high reps. If you go heavier on the weights, then you can do lower reps.
Oh, so you are talking about lifting something though.
Yes, I definitely am talking about lifting
Okay.
something.
Okay. So I could start with a water bottle or a heavy vitamin bottle. This is really heavy. Um, but so you really talking about and just doing this would be good, a good
Yep.
start. So we
I,
could do that while we watch television.
Absolutely. Some of the things you don't even have to, disturb your normal flow. If that's watching television while you're there, lift up a couple water bottles, a liter bottle, whatever it is, and, do a couple of reps to help strengthen those bones. The other one is watching what we eat, right? That's very important. We always talk about like moderation, you follow the food pyramid, et cetera, in terms of, how much you should eat and things of that nature, but making sure you consume enough protein, make sure that you consume enough veggies and getting that in, the adequate nutrition that you need so you can have the energy to expel throughout the day and not always feel so fatigued and tired.
Energy to expel. What does
Yeah.
that mean?
So energy, so whatever your day consists of, you want to make sure that you have the adequate energy, so the nutritional intake to be able to fulfill your daily responsibilities. So not eating like a full fatty meal of like something fried or things of that nature with bad fats, good fats are good, like the avocado, salmon, things of that nature. So those types of foods that will help you be sustainable and complete your work day without feeling so tired and sluggish throughout the day.
Okay.
So having that adequate caloric intake and that balance. Some of the other recommendations in terms of our modifiable risk factors is also the alcohol consumption. So I personally do not drink any alcohol, but there's nothing wrong with individuals who choose to do so. So drinking alcohol in moderation is completely fine, but not consuming so many drinks throughout the day or the week, because that also can put us at higher risk for the development of cancer or the other conditions that we
But some people only have one drink a day, but it's a huge one and it takes all day.
I've seen some of those wine glasses.
We just have to be mindful, because even the amount
Yeah,
of that one glass that you have with dinner. A wine glass was never intended to be
to be
filled to the
full.
brim.
Right.
It's just a little something, something, so at the bottom, and that's one glass.
Yeah.
So we just have to be mindful of, if it's not our serving size per se,
Yes.
but it's a healthy, moderate level.
Yes, absolutely. That's very important. The other thing in terms of risk factors, I'm just going to switch gears to some of the things that we can't change, and these are our non-modifiable risk factors. One thing that puts some races at risk is just that, your race. You can't change, who you were born, how you were born, things of that nature. You also can't change your family history. So genetics plays a very important part in certain types of cancers that can put individuals at higher risk for certain diseases and conditions. Your gender, so females, of course, are at increased risk for the development of breast cancers or female types of cancers, as well as males are at higher risk for other types of cancers. But when we look at some of the other diseases like multiple myeloma, Hodgkin's, men tend to be a little bit at the higher risk for the development of those diseases, especially African American men as well. And sometimes when we look at the disparity that exists amongst African Americans, and you mentioned this earlier, it's insurance, sometimes it's your zip code, access to facilities. You also do have professional biases, where some of the healthcare providers don't choose to offer certain treatments because they don't feel as though some individuals will be compliant with the regimen. And they don't choose to offer clinical trials because they don't feel that that individual will be compliant with the clinical trial. We do know that's how medicines are approved in general, but you want to ensure that you do have quality data, but you also want to be inclusive to make sure that all populations are represented throughout the clinical trials, because every drug works completely different in different races. So that's
Right.
something that's important to make sure that I mentioned, especially on this platform with all the listeners that will be listening to this. So I'll stop my soapbox. I have so much.
But the reality is, I talked to one of my doctor friends, and we were having a conversation, because she African American oncology surgeon, and she said that a number of her patients would ask her, African American patients asking an African American doctor, how come you don't refer me to clinical trials? She said, why would I? She said, you don't take your high blood pressure medicine. How am I supposed to know that you're going to follow through with this? And then the patient said, well, how do you know I don't take my medicine? She said, when was the last time you got a refill? It's like we're demonstrating to the doctors, things that we don't think they know.
Yeah.
that they're on our behavior, our pattern of caring for ourselves. We walk in there, doctor says, "Have you been taking your medicine?" "Oh yeah." "Okay, but the last refill it was 6 months ago." When even a refill is about 3 months.
Yeah.
So
Yeah.
that means that it's been longer than 6 months since you've probably been consistently taking this medication
Yeah.
as prescribed.
Yeah.
And even though some of those medications can be prevention tools, because there's one of the medications that I take now that I actually saw on TV, and it says this medicine does XYZ, and I was like, oh my goodness. So I immediately emailed my doctor and I said, this is the medication I'm taking, this is how many, this is what the TV said, what please advise. And so the doctor said, well, why don't you just start taking one? But you cannot stop taking this because of the other health ailments that I had
Yeah.
that would cause another cancer to reoccur
Yeah.
if I stop taking it altogether. And then they said, and then we'll watch it and we'll evaluate so that we can go forward. And that's what is so important, that we have to have communication with the doctor. It might be that I get increased back to 2 of those pills, depending on how my numbers go, how my scans and my other tests go.
Yeah.
But you've got to communicate, so that, because everybody is different.
That's so true. But
But we
you
can't
bring
just
up
be on TV, see something happen on TV or Dr. Google, and and then say, I'm not taking this, because it has an effect on us too, right?
That's so true. Mentally. But you have to, I always tell people when they say that, it's like, you see that, but don't forget the common Tylenol also has some scary, adverse events. And those are reported, and they have to be, which is important as being transparent, and it's required by the FDA, who regulates these drugs, that they are reported in 5 to 10% of the patients who participated in that clinical trial, right? So some of these drugs, even after they may have accelerated approvals by the FDA, they still have to undergo a post-marketing surveillance to ensure that once it's opened up to the general public, that these individuals are still being monitored, and that any adverse events or side effects, they still must be reported back to the FDA so that they can continue to watch this particular drug that was recently approved. So
Even if it only affects one person.
So no, not if it affects just one person.
Okay.
So it's whomever, it's the treating physician, nurse practitioner, whomever's rendering care, the nurse responsibility to report that. So there are certain things and certain forms that have to be reported when there is an adverse event that is seen by a patient. They also have the duty to report that to the sponsor. So whoever the pharmaceutical company is that is, developing this particular compound, especially for a patient who was on a clinical trial, and especially if that drug was recently approved and it's under the post-marketing surveillance. Now, with that being said, still, if a patient experiences an unwanted or, a side effect, adverse event that's unwarranted, from taking this particular medication, that still is the responsibility of the healthcare provider to report that to the FDA as well.
Okay.
That's with any drug.
Okay. So we've talked about exercise, moving.
Yes.
We've talked about watching what you eat and not just looking at it as you consume it.
Yeah. That's good
I'm sorry.
too.
I tend to bring the humor in and things, because these conversations sometimes are so heavy, but things that I make light of, it's some things that people actually think. So that's still to be mindful. So what else do we need to be considerate of in
as women, we are hormonal individuals. So, and if you are of your childbearing years, you want to have children, that also can help to reduce your risk of certain gynecologic cancers. As well, if you breastfeed, that also helps to reduce your risk for the development of specifically breast cancer. It's still a lot of controversy in regards to some of the oral contraceptives. Some say that, you know, that they increase your risk, while others will say if you take these specific types of contraceptives during a certain time point in your life, that
Wow.
that actually helps to decrease your risk of the development of both breast and ovarian cancer. So you have to, you know, kind of fall into that specific criteria. And that's something that's determined on an individual basis, also in terms of what those oral contraceptives were prescribed to that individual and how long they took those oral contraceptives can help to decrease your risk. But for the most part, I think we've talked about most of the modifiable risk factors that we can actually take action of. And of course, one of the other things is just minimizing our exposure and decreasing our exposure to some of the known environmental factors that can potentially put us at risk for, you know, certain cancers. Like if you're a plumber, you know, a welder, you know, making sure you wear the appropriate protective equipment so that you don't inhale certain things or, you know, are seeing certain things, protecting your eyes, etc. So some of those certainly do help to reduce our risk of the development of cancer and other chronic conditions.
What about the consumption of water?
That's always important. Our body is comprised of water, majority. That helps with blood circulation, movement, things of that nature. So that's very important. But I don't want to give a certain amount of water because certain individuals who have certain conditions can't take in you know, too much of those fluids because it can cause other problems to their heart and their kidneys, etc. But
Yeah.
it is actually recommended that you at least consume that 8 to 10, 8 ounces of water a day. And when you're working
And,
out, it's important to make sure that those joints are lubricated.
and for most of us, you know, that's even a conversation to have with our physician,
Yeah.
on how much water can I consume, you know, just to make sure how much exercise can I do, you know, how much food should I be intaking, because everybody is not the same.
Yeah. And everyone's goals are completely different.
Mhm.
Everybody's genetic makeup is different. Everybody's body is made, you know, different. And as I stated, without knowing, you know, a certain individual's medical history to say like this is what's safe for everybody. To me, there's no one rule fits all when it comes to healthcare. It needs to be personalized medicine.
Yes, I completely agree with that.
Yeah.
Okay. So, is there anything else in regards to prevention?
I think I highlighted the key points in terms of the non-modifiable and the modifiable risk factors. We're calling that out. The other thing that I want to make sure that I express is that, and I've expressed this earlier, follow-up examinations. Making sure you always go for your annual appointments, women and men. I have to force my husband. I schedule you know, every year. Like you need to go. Certain things for certain ethnicities and races need to be done earlier than later because of our genetic makeup. So mammograms are certainly recommended every year. If you have a family member who has had breast cancer, such as your mom, a close individual, first degree relative that's had cancer, then you should not follow the normal recommendation for those screenings. You will start getting screened 10 years earlier, so prior to the date that she or he was diagnosed with those cancers. So again, important to make sure that you have the annual examination. Colonoscopies are very important. Colon cancer is a disease that can certainly be prevented through colonoscopies because polyps and any abnormal cells can be identified via that route. They also now have the Cologuard home testing that can be done, but that's only for specific individuals, not in the higher risk category. So that, certainly deems a conversation with your primary care physician or internist to be able to discuss what's the best option for you based on your medical history. Mammograms is something that we talked about. And then with your annual examination, you want to make sure if you're a woman that you are, getting your breast exam. You're also getting that pelvic examination, the pap smear, et cetera, that comes along with that process. Because again, those cancers can be identified early and action can be taken to help you have the best outcome for yourself. And the same for men. Prostate examinations are certainly something that is of importance to ensure that are done for men, young Black men, especially if you have a family history. You don't want to wait until the age of 50. You want to start those earlier. What's recommended by some, the United States Preventive Services Prostate Cancer, the task force, that working group, you want to start at the age of 40 or 45, depending on your family history and that genetic makeup, to ensure that your risk of being diagnosed with prostate cancer, that you, at least if you are at higher risk, that you do have the best possible outcome in terms of treatment or diagnostics, et cetera.
Now, I understand that the prostate cancer exam for prevention purposes is not, because we used to see them all the time, but now that we're not seeing them so much. Do we know why?
I don't know if it's just an isolated thing for the West Coast, but I can tell you, I have been a part of organizations here in my area, and that's something that they still encourage, especially with the urologists, and with the primary care physicians. Even, my husband just turned 40, I forget, 46, but needless to say, he actually, because he has a family history, his primary care physician actually started to do just what's called the PSA testing, which is the blood draw, just to see if that was elevated due to him having a first degree relative with prostate cancer.
Okay. So, so here, I don't want to, go into the whole thing about it because I don't know that I have it straight in my mind.
That's okay.
But the biggest thing to do is at age 40, start having that conversation with your doctor.
Absolutely, especially if there's a family history. Start having a conversation in regards to what's that plan. What's important is the degree relative, first degree relative, it's the second degree relative, and how many individuals were diagnosed with prostate cancer in your family, to start having that conversation with your primary care physician.
Okay. So then there's also a lot of people don't realize now that there is a test for lung cancer screening, but it's not open to everybody.
Well, I think the data is still a little bit new. So it depending on, again, family history, signs and symptoms, et cetera, what's going on with that particular patient at that time to actually see what's warranted. And keep in mind, like some cancers, some of the testing is not as specific as the other tests that will actually confirm if like something's going on to warrant more diagnostic, more screening. So the other thing is you really don't want to create that fear for the individual until you actually are confident in the science. So for the lung cancer screening, there are still a lot of, or the testing that you just mentioned, there's still a lot of the unknowns in regards to that. So more evidence should be generated to actually confirm the validity of this type of testing for everyone.
Okay. Wow. This has been so informative. Is there anything else that we need to cover? You know what? I'm going to ask this because I'm looking at a couple of people that are online. Um, but what's something that's always gotten me is how they tend to put an age limit on some screenings.
Mhm.
Because so I say, what happens after 75? I'm kind of close to that. So, what happens or what do we do for prevention or continued screening or whatever that might be if we're at that place where they say you don't need this anymore, but I still have every bit of energy, enthusiasm, because I'm gonna tell you, my mom is up there in age and you wouldn't know it.
That's a good point, Pastor.
You would not know it.
So again, that's going to go back to um, personalized care and making sure that the decision is based on the individual. A lot of these decisions were made because of the lifespan of the average American male and average, American female. But as I stated, we both know that there's no one rule fits all because I plan to be one of those very active 75-year-olds. So you cannot deny me anything if I say I want that.
Right.
But the other thing, as a healthcare professional, you have to make sure that the benefits also outweigh the risk when you are making these types of decisions. And do I want to put my 85, 89, 90-year-old mom or dad under, certain treatments if they may only have, 10 more years or whatever to live? But you have to make that as a conscious decision in regards to what will be best for that individual. And if they're healthy, sparky, spunky 75-year-old, then yeah. And I'm quite sure that the physician will not have any issues with, pursuing that as well. But again, it's really going to come back to that individual personalized care for individuals.
Because there's I'm gonna say this young man that I go to church with. He's 90 plus years old,
Wow.
still looks good, still driving.
Wow.
In fact, we went back to church and I saw him the other day, and I just couldn't help but just to grab his little face and say, "I'm just so happy to see you." Because so much has happened through the COVID year, 18 months.
Yeah.
But for somebody to tell me that they refuse a prevention of care for him, that would just blow my mind. I'm like,
Yeah.
do you see this guy?
Yeah. Like he looks good.
Still driving. Wait, still driving, and his car has no dents in it.
Wow. He's doing something right. He's got
Exactly.
some good genes. He's taking care of himself.
And that's what we all need to do. If we can just be mindful enough to care about me,
Yeah.
to deliberately, I keep going back to this, recently is we don't think our process all the way through. We think we need to get to the next moment. We don't even think about the fact that it needs to be a quality moment.
Yeah.
We really don't. I think because there's so much going on, even in the stay-at-home plan. We have found home projects to do. We have found new crafts to do, new people to talk to. More sedentary, more social media, more. I mean, and I never even heard about. What do they call it? Binge watching. I never even heard binge watching before COVID. And all these movies that have 3 and 4 series of 18 of 18 episodes each. I'm like, and we watched the whole thing, the whole thing. So with all this coming along, we have to get to a place where we're thinking more healthy.
Yeah.
That is not just a goal to be six feet above ground, The goal is to have longevity. The goal is to be around to continue the legacy of your family. The goal is to be able to encourage the generations behind you to be healthier than what they're doing. Convenience is not always healthy.
That's so true.
For
That's
me
that's
to stay home in this season, I have to admit, I still eat out, but I have better places to choose from, through Postmates. I can pick a restaurant that actually cooks the food almost like home versus our fast food
Mhm.
establishments. Where before it was just whoop, whatever has a drive through, so those are some things that we just need to be mindful of and do it on purpose. When
Yeah,
we begin to live on purpose, we begin to do things differently.
I agree. That's well said, Pastor Rhonda. Living life with purpose. I think another point just to add to that is work-life balance.
Yes.
This pandemic has shown us a lot. Even for me, being a director and a professor, et cetera, having that work-life balance. Previously before COVID, I did a lot of Zoom, Teams meetings, WebEx presentations, but due to COVID, a lot more of that had increased for my workday. So what I learned to do myself was just to schedule breaks on my calendar. Because if someone saw that I had 30 minutes free in a day, they were snatching it up like, oh yeah, I need to talk to Maggie about X, Y, and Z. So I block private, like, no. So I need get up and walk around break. I need a break just to eat. I do not like sitting here from 5 a.m. in the morning until 6 or 7 at night because I'm on calls. So I scheduled that time for myself just mentally. Let me walk around, let me stretch my legs. And for me, I'm a very early morning riser.
Oh,
So my day begins with my workout, and after that, it's time to eat breakfast. And then I'm the first one up in my home. So then it's time to work. Let me, prepare my day. Let me see who I'm talking to, what I need to do if I'm presenting, etc. But I learned that scheduling breaks throughout the day, blocking times on your calendar, certainly helped me to have more balance throughout my workday. And also, if I need to schedule a meeting with someone, I don't always need to necessarily block that entire 1 hour. Like, give me 45 minutes. Take the rest of the 15 minutes to get ready for your next meeting or whatever the case may be. So we can get a lot done by just, planning and prioritizing our day.
and for me, I was sitting in this very spot too many hours a day. I mean, I would bring my food here, even if I wasn't in a meeting. I would bring my because it's just a comfortable spot. I mean, you can't see all my little goodies all around, but I'm right here. I would get up. I would come here and check my calendar. I would come here and eat my food. I would come here for all my Zoom meetings. I have a calendar that I actually send people the link that tells them the availability. So I'm not on the phone spending most of my time trying to find a date that works for us. Here's my calendar, you make it work. But what I didn't do, you said even 30 minutes, I wouldn't block it until it was an hour or more.
Um,
But so what I did was I stopped sitting here to eat and would leave here and go to another space so that I was having a lunch break rather than just watching what I eat.
Mhm.
But there's things that you have to do on purpose. As the sun has come out here in sunny California, I even go out in the backyard, even if it's just for 15 minutes and just sit. No phone, no computer, no body. Just go out there and sit. And see, I live in the airplane path. So I can watch airplanes. I'm entertained. Find out how often does the FedEx truck really come back and forth. But there are things that we have to do on purpose.
Yeah.
And I keep coming back to on purpose because you have to decide. In fact, my motto for this show is choose life. Because if you choose life, there are some other things that you just automatically choose not to do.
So true.
So, so you're talking about work-life balance in all of this, and even putting back on your regular clothes instead of those comfy clothes that expand as you do, so that we know when something is changing with our weight. We don't need a scale to tell us.
No, we don't.
Then we're looking at ourselves every day and looking at it every day, because Zoom, it will allow you to, it will do some perfecting for you. Everybody doesn't know that, but so by going through some things that, there's some little angles that you could do to make you not look, like you don't want to look. So even that, getting up and getting dressed every day, is a huge part of balancing your life.
That's so true.
Not just rolling out of bed and going to, washing your face and going to a meeting. Because the people you're meeting with today were not the people from yesterday. So you put the same thing back on. Right? But we have to be, when we, and I'm still talking about prevention, of taking care of us.
True.
Still just taking care of us. So because once you start taking care of you better. So once you start taking care of you better, you remember what yesterday was, and you want to do better than yesterday.
That's so true.
Because somebody says, how much exercise should I do? How much water should I drink? How much food should I eat? Or what should I do about my food intake? You know what I always tell them? I tell them all the same thing all the time. Better than you did yesterday.
That's so true.
Because maybe this is the goal. And maybe you really are down here because you were up here and you were down. But start where you are.
Yeah.
And do better than that tomorrow or today. At least get the plan today so you can do better tomorrow. Because we really do have to get our mind together to make the change sometimes.
I agree. It's spiritual, it's mental, it's physical. It takes all three of those things for us to be able to get financial, yeah, true. Because it's unfortunate that it's more expensive to get a salad from Panera than it is to get, go to McDonald's, as you stated, like the convenience of going through the drive-thru to get a quick meal that also includes a drink. So you're meeting the needs of the thirst, the hunger, etc. But we have to make those deliberate choices in order to produce a better us. And whatever that, is for every single individual, it'll be a personalized type of decision and choices that are being made. We just have to make the conscious effort to do better than we did yesterday, the day before. For me, I track everything that I eat, everything that I do. If it's not on my Apple Watch, I have that sync with my Fitness Pal. So that helps me to make sure that I'm staying under my fat goal. I stay in alignment with my carb intake and my fat intake, all that good stuff. So I'm logging everything in, making sure that I have less going in. I'm going back to that caloric expelling and expenditure to make sure there's that balance there, and that I'm trying to be as healthy as I possibly can be, because I know that helps me to be better prepared mentally, physically, spiritually, to be able to face whatever I have to face for that day.
And speaking of going in and coming out, elimination is real important.
Yeah.
You cannot keep consuming with minimal elimination.
Yeah.
So we need to be aware of that as well, because that's just toxins building up in our body, right?
So true. So true.
So, and if a person is having challenges with that, have that conversation with your doctor.
Absolutely.
And because, I again, we keep saying this over and over, everybody is different. So once you talk with your physician, you know what is normal for you and what works for you versus sitting back saying, oh, this is just normal. So we want to make sure that we're being aware of everything about us
Yeah.
so that we can be the best person, not just for ourselves, but for our family and our loved ones as well.
Absolutely. That's important. Consistency matters. As I stated, if you see things persisting for 2 weeks or more, that's not right. Don't be dismissive in regards to some of these signs and symptoms that you see and continue to take the at home over the counter remedies. Because sometimes some of these things, they just don't go away.
Amen. Amen. Well, this has been a marvelous conversation, Dr. Maggie. Thank you so much for coming on and being with us today, and sharing insight in a fun way. In a fun way. So, I thank you for coming on. I look forward to some of our other conversations. I
Yes.
saw one of my friends who's an oncology nurse who was popped in today, and hopefully one day we can get her to come in and share with us as well. But just a little bit about Celebrate Life Cancer Ministry and our services. We actually provide patient navigation services. We're treatment buddies, telephone buddies. We have exercise classes. We do wellness checks, monthly support group meeting, which we just had yesterday. We meet on the first Saturday of each month at 10 o'clock Pacific time. We do home and hospital visitation and hospice support. And if anyone is in need of the services of Celebrate Life Cancer Ministry, we invite you to give us a call at 323-577-5443, or reach out to us through social media or any of the other avenues of communication. And we are here to provide support. You don't have to live in California to be supported by Celebrate Life. If there are resources that you need in your neighborhood, we will help you research those resources, talk to them for you, vet them for you, and make sure that that is where you need to go to get the services you provide, because you do not have to go through the cancer journey by yourself. You're never alone. Just reach out to us and let us know how we could be of service to you. Dr. Maggie, thank you so much. So, so much. This is a new relationship, but rest assured, this is not going away.
Well, thank you again for having me, Pastor Rhonda. I look forward to the next time of you and I connecting to discuss a different topic. And I welcome any other questions, comments from the listeners. And I love the services that the organization provides. These are all fabulous.
Amen. Amen. So, as we always say, until next time, choose life.